All right. So today, our Let's Get Real, we're talking about movement prep. So Callie last month went over some foundational information about warming up. So we're going to talk a little bit more about that and also talk about our new program that we're using, Fusionetics. We have an August Fusionetics challenge going on right now where if you do a movement assessment and complete 8 of the 12 prescribed workouts, you can be entered into a drawing to win a little movement kit. So this is going to be a little bit about the Fusionetics program, a little bit about movement assessments in general, and a little bit larger overview of what corrective exercise programming means, which is what the Fusionetics program uses. So the first step is doing a movement assessment. So this is where the Fusionetics movement assessment comes in. And this is where we're kind of identifying the problems, and problems is in quotations because it's not necessarily a bad thing. It's just different deficits in how you might be moving that could potentially lead to injury and that we do want to correct, but it's not that you're moving badly or anything. So to just go over what a movement assessment is a tool that fitness professionals use to assess how your body moves through basic functional movement patterns. So these movement patterns are selected to replicate basic gym movements as well as movements you would use in your everyday life. And as you move through the movement assessment, the fitness professional, so one of us on the Power Station staff that's administering your test, will observe your movement from multiple angles and take some notes. So we'll kind of just walk around you, make some notes on our clipboard. And what we're looking for are compensations, which are certain motions that may indicate a neural or muscular dysfunction. So it's important during these assessments to move as you normally would so we can best determine any areas with compensations. And then the results of the movement assessment, which is basically the summary of those movement compensations during those foundational movement patterns, helps us to develop a corrective exercise program. And we'll talk a little bit more about the specifics of that in a later slide. But looking at what our compensations mean, the compensations that we're looking for are indicative of overactive and underactive muscle pairs. So that bottom picture kind of demonstrates that concept. And then the top picture, for example, a lot of people have tight hip flexors from sitting for long periods of time, and this tends to pull the pelvis forward, which lengthens the hamstrings, which puts them at a worse angle to generate force. And this eventually leads to the hamstrings becoming weak and underactive as the hip flexors take over. So that's just a good example. It's a pretty common example that we see a lot, and kind of is illustrated by both of those pictures combined. And opposing muscles that have an overactive and an underactive component can lead to increased injury risk, reduced efficiency, and can also lead to other impairments along the kinetic chain, so further up or further down from the joint that we're looking at. Going back to our hip flexor and hamstring example, the hamstring is put at increased injury risk of strain because it is lengthened and weakened. It's also less effective at producing force, which could decrease something like your running economy or decrease the ability to move a lot of weight in a squat. And it can also alter the way your knee and ankle move. So not only are the hamstrings themselves affected, but it can also affect other parts of the body. So then what we're doing with the corrective exercise program is addressing these overactive and underactive muscle pairs that we identified from the movement assessment. So the program layout, and if you've done a Fusionetics assessment, you've seen it laid out like this with your inhibit, lengthen, activate, integrate stages. The first 2 stages of a corrective exercise program help to inhibit and lengthen muscles that are identified as tight or overactive. So the first stage, inhibition, uses foam rolling or self-massage techniques which stimulate the nervous system to essentially be less reactive when recruiting those muscles. And then the lengthening phase uses static stretching to increase the muscle length, so to increase those overactive or tight muscles. The third phase, the activation phase, addresses underactive muscles to both strengthen them and increase neural control. And then the last phase, integration, is intended to retrain how you move by getting those overactive muscles that you inhibited and lengthened to work with the underactive muscles that you activated to function in optimal muscle balance. So some important reminders when you're going through a corrective exercise program: it is designed to be used as a warm-up prior to exercise that would be using the overactive and underactive muscles that you addressed. So in other words, it wouldn't be the most efficient thing to do a lower body focused corrective exercise program before an upper body lifting day, or an upper body corrective exercise program before something like a cycle class. So as Callie talked about last month with her Let's Get Real about warming up, you do want your warm up to kind of mimic what you're going to be doing in your workout. And then one of the biggest mistakes that I've seen people make is treating the corrective exercise program like a strength or circuit workout. So while the exercises are set up similarly, the focus really should be on proper form and control. The exercises should be done slowly and minimally weighted. And it's normal to feel challenged during a corrective exercise program, but you're not going to be feeling fatigued like you would with a traditional workout, like a circuit workout or a strength workout. So it really is more of a warm up, but a little bit more of a specific warm up, specifically addressing those underactive and overactive muscles. And then I'll go over some form checkpoints in the next slide because those are also very important to pay attention to when you're going through your corrective exercise program. And then lastly, just consistency is key. You really need to kind of stick with these to get these changes to stick and to address the compensations. And with that, you should be reassessing. So taking a new movement assessment once you finish your corrective exercise program, which should be about every 4 to 8 weeks. So when you're going through your corrective exercise warm up, these are things you really want to be keeping in mind, and we'll start kind of from the bottom and work our way up. So at the foot and ankle, you want to focus on maintaining the arch of your foot. So kind of like gripping the toes into the ground, not letting your arch collapse towards the ground. So we're avoiding overpronation or supination. If you're not sure what that looks like, you can always ask one of us and we can show you how to avoid it and what it looks like so you can kind of check yourself while you're doing these things. And then at the knees, this is one we usually know to pay attention to. We want to make sure the knees are tracking over the toes and there's minimal lateral motion so your knee isn't moving in or out as you do something like a squat or a lunge. At the hips and core, for most exercises, you're going to want your hips to stay even. You'll also want to focus on your core engagement, which will help you to avoid low back arching or rounding. And then at the shoulders, for most exercises, you're going to be focusing on scapular retraction and depression and avoiding a rounded shoulder posture, so not having our shoulders slumped forward. And then at the head and neck, we want to make sure the head and neck is in line with the torso. So a lot of times we have the tendency to drop the neck when we're doing something prone, like a push-up kind of movement. We just want to keep that nice straight line. So all of these things are things you should be thinking of and consciously trying to avoid doing while you're doing your corrective exercise program. So it's a little bit more complex and involved than just going through the motions and doing the exercises prescribed. You really want to be focusing on taking in all these form checkpoints and make sure you're doing the exercises correctly so they can help as they are intended to do. So if that was a lot of information or you're still not really sure about some of the things, the Fusionetics, if you do your movement assessment through them, you'll be able to access your corrective exercise program either through their website or through their mobile app, which does have a lot of good exercise videos and descriptions. One thing I will say is they're not as thorough about going through the form checkpoints that we just went over. So you can always ask one of us, one of the Power Station staff members, about specific exercises or if there's anything you should specifically be paying attention to, because we can give you a little bit more information about that. And then if you're feeling like you really need some more focused coaching or training, we are offering personal training on site at the Power Station as well. So that's it for our presentation today. If you haven't come in for a Fusion Genetics movement assessment, you can stop by the power station or email us to set one up. And until the end of August, you'll be able to, get in on that challenge that we're doing and take your movement assessment, do the workouts, and then have a chance to win a prize. So if you need more information about that, you can also stop in or email us. But other than that, I think that's it. So thank you guys for coming. I'll take any questions.
How long does it take to do the assessment?
The assessment takes less than 10 minutes. It's pretty quick. You'll do like 3 or 4 reps of each exercise as we watch you. I think there's maybe 10 or 12 movements total. So it's pretty quick to do the assessment.
No, okay. Interesting. Okay, thanks.
You're welcome. All right, if that's it then, always feel free to reach out if you think of any questions later. But thank you guys for coming. We'll see you next month.
Thanks a lot.
Yeah, thank you.